Hey y'all, it's me, Dr. Smina Rahman, Gyno Girl, here today to talk to you guys about a little bit of a different topic that I don't talk about much. In my last session when I talked about the ISHWISH conference, I did discuss the possibility of talking about some issues around male sexual dysfunction. Now, what's a gynecologist like me talking about that for? Well, the truth of the matter is, as a sex med gynecologist, I treat a lot of individuals who identify as women for their sexual pain and sexual complaints. Well, what if the issue isn't all about your vestibule or your genitourinary syndrome or menopause or your pelvic floor? What if it has a lot to do with what's happening with your partner? A lot of my patients have male partners and chosen to partner with individuals who identify as men, and basically, they have issues when it comes to sex, and maybe not so much because of something going on with them, but it's a partnered situation. So we have to look at, is there something else going on for your partner? And maybe you're the one that can get them the help they need. Because the reality is, I know from my own experience in terms of like trying to get my husband to go to the doctor for any reason, it doesn't happen. So, unless I push him. So the same thing here, I wanted to give you guys a little update on something called Peyronie's disease. A lot of my colleagues talk a lot about erectile dysfunction, my urology friends, and you can learn more about that, and I might have a discussion about that. But Peyronie's disease is what I want to get into and talk about how it affects female sexual functioning as well. So let's get at it. Hey y'all, so welcome back to Gyno Girl TV. Again, I'm Dr. Smina Rahman, known as Gyno Girl in the social media world. I am a sex med gynecologist and a menopause specialist. For those of you first-time listeners here, I have a practice in downtown Chicago where I take care of a lot of vulva owners. And I also have a clinical assistant, a professorship at Northwestern Feinberg School of Medicine where I teach students and residents. I'm very excited to talk to you guys about something a little different. But before I do, please like and subscribe to my channel. Tell me some comments of things you want to hear. And also join me over in the podcast world. I launched a podcast recently called Gyno Girl Presents Sex, Drugs, and Hormones. I have patients telling me their amazing stories. I have experts and friends that are on there telling me all the great information that you want to hear. So we're here to educate so you can advocate. So come on over to the podcast world as well. But today, if you listened to my last episode on ISHWISH, the International Society for the Study of Women's Sexual Health, we talked about a lot of different things. One of the fun things I got to do was work on an advisory panel with endopharmaceuticals. Okay, so endopharmaceuticals is responsible for making a medication that treats Peyronie's disease. So why do they want to talk to a bunch of gynecologists along with a few urologists? Well, Peyronie's disease, whenever I talk to my patients about their own sexual dysfunction, of course I treat a lot of midlife women, but I treat younger patients as well. And if they're the individuals who are having sex with men, of course we always address that issue, like how is your partner, like what's going on with your partner? Do they have any issues or concerns? Is your low libido related to anything going on with your partner as well? Like what's happening? So sometimes patients will tell me, yeah, I'm dealing with some midlife women who are having sex with midlife men who might have diabetes and heart disease and all that hypertension. So they might have, erectile dysfunction. We know that when men have erectile dysfunction, it's a first sign of potentially something happening with their heart. So it is a vital sign in that capacity. So people should get checked out, make sure they don't have diabetes, make sure they're not hypertensive, have coronary artery disease, any of that stuff, right? But every once in a while, I have a patient who tells me, I do have a lot of pain, but I think it's related to the fact that when my husband becomes erect, his penis is sort of bent, and I'm trying to get into a direction that fits, and I can't maneuver it in such a way. And so I don't know what to do about it. It's this weird bending, and then it shortens, blah, blah, blah. So patients will tell me that, and I'm like, oh, your husband or significant other has Peyronie's disease. Now, why is a gynecologist like me talking about Peyronie's disease? Okay, other than the fact that I was on the advisory board recently, I did remember, I think the first time I heard about Peyronie's disease, I'm totally aging myself because this was probably in college or something, but for those of you who remember former President Bill Clinton, he had a lot of sex scandals happening, and there was one sexual harassment case about Paula Jones, who was somebody he worked with in Arkansas. I'm probably not gonna get all this information right, but he did at the time, she did describe his penis as being kinked over or bent or something like that. So I remember hearing the term Peyronie's disease for this first time. And then I learned about it a little bit in med school, like you get like maybe a sentence about it here and there because it's supposed to be a really rare disease. And then I did a urology rotation, and I have brothers who are urologists, so I know about it a little bit more than maybe the average gynecologist might. But just, for you guys to understand, Peyronie's disease is a defect in wound healing for a lot of patients, and it has a genetic predisposition for sure. So patients who potentially have something happening in their collagen activity, might be more predisposed to it. And then you might have traumas or other situation, micro traumas, that kind of create a perfect storm of events for these plaques that form in part of the penis. So if you look at this cross section of the penis, you have, your fascia and the connective tissue around it, which one of the areas is called the tunica albuginea, which is your connective tissue that surrounds your erectile tissue. So you have the corpus spongiosum and the corpus cavernosa. And so basically that's the tissue that gets engorged so that you can have an erection. And then you see here that there's like this plaque that forms, and that plaque is a fibrinous plaque that creates a defect, right, in the penis. And so some patients, may start out with just penile pain, which is no fun for them, and they might get like anti-inflammatories or something. But over time, you might have like a rigid plaque that forms, so that such that when the penis becomes erect, it bends in a certain direction, and maybe it bends 30 degrees or less, or bends 30 degrees or more, and then you kind of go down a treatment protocol. Now the problem is there's so much shame associated with this for men as well that they may not talk about it. So, what's the prevalence of this kind of thing? We used to think it was like less than 1%, but we know it's more than that. There's studies that have shown, anywhere from like 9 to 13%, depending on which survey you're looking at. And then patients who are diabetic with erectile dysfunction, I think, can have up to 20% of them might have Peyronie's disease. So it is more common than we think. When we learned about it, it was like this extremely rare condition. And again, I don't treat this in my office. I refer my patients to have their husbands get checked out by urologists, and then, they're the ones that treat it for the most part. But, it can cause a lot of pain, right? It can cause a lot of discomfort. It's a lot of shame associated with it. We know that young guys can get it too, with different kinds of trauma that occurs. You may develop these defect in wound healing that leads to these plaques to form. And so those patients might be more prone to going to get it checked out, but they're not talking about it necessarily with their partners. Whereas in my patient population, if I have a patient who is in the midlife, and they've been with their partner for a long time, or even just newly with them, they might be the ones that push their partners to go get checked out. Like, I have patients my last patient that told me about her husband with Peyronie's disease, like, oh, I just have to like manipulate myself in this direction or that direction and try to get it in, and then it's like very painful for me to do that. That's not okay. Like, it's not okay for the partner. It's not okay for the person suffering with the pain either. And so both people are in pain then. And then both people are suffering, and then no one's having enjoyable sex, and then relationship problems may develop as a result. And so, it's something that we should talk to patients about. I talk to my patients about, and a lot of my patients bring in their significant others, because, they have very supportive, boyfriends, spouses, girlfriends, whatever. And they bring them in, and we talk to them about it. And we talk about their problems, and it's, obviously, like you're having sex with somebody usually, so let's talk about what's happening, right? So, the reality is we need to make people more aware of this, right? So sure, there's a genetic predisposition, there's different damages that happen to the penis. So you have these different plaques that form, and they cause problems, right? So where did I come in on this with the endopharmaceuticals was that we talked about their injectable medication, Xiaflex. Now, before a lot of people use Xiaflex, they might use this oral pill called pentoxiflin. And so basically this medication, is a phosphodiesterase inhibitor. And so it kind of prevents it's a non-specific one. It kind of prevents fibrotic. So a lot of patients will first use an oral medication called pentoxiflin and before trying like injectables or surgery. And basically with the use of this medication, I think it's a non-specific phosphodiesterase inhibitor, and so it kind of decreases fibrosis and deposition. So a lot of patients will take that medication and see if they'll get any benefit. And if someone has like more than a 30-degree curve in their penis, then they can take this medication called Xiaflex, which is Apollagenous Clostridium histolyticum. Basically, it's an injectable medication that someone trained in this will inject into the plaques and in the penis. And I think the protocol, from what I remember, is you inject 24 to 48 hours apart, 2 injections. In that period of time, there's some penile traction and remodeling that happens with the supervising doctor. And then you go home for 6 weeks and you do your own penile remodeling. And then you can come back after 6 weeks. And you can get, I think, up to 8 injections. So you can try it again like 4 more times to see if we can decrease the curvature of the penis. And so I think that, it has pretty good success rates in the studies that have been shown, at least like I think a 17-degree reduction, more than 30% improvement for most patients. And the studies we looked at, in this group was that, okay, like the men were getting satisfied, right? Because they were getting improvement in symptoms. And then the patients, there was a study done where, I think it was only like 30 patients that they could get their female counterparts to fill out the survey for their female sexual index score before and after the use of this medication. And basically, there was an improvement in overall function and decreased amount of pain, decreased amount of concerns around arousal desire. There's still some concerns and hesitancy with, the partner when it comes to like, I don't want to damage it again, I don't want this, I don't want that. But overall satisfaction was improved. And we're going to continue to look at that aspect, the female partner as well as the male partner and what's happening. And there's overall improvement in both female and male satisfaction after the use of this medication, this injectable medication called Xiaflex. And I don't do this procedure in my office. I'm not a urologist, I'm a gynecologist, but I do refer my patients and their partners to urologists who are trained in this. I don't think every urologist is trained in this as of yet, but they have on the website, I think, a number of urologists that are trained in this procedure and with varying degrees of success. So you could always talk to them about that. Some of the minor side effects, obviously, like penile swelling, hematoma, those usually dissipate, and I think the number of adverse events usually dissipate in a very short period of time. And you can discuss this again with your urologist who will be doing this injection. And then, penile traction and remodeling is also part of the procedure, but also, independently, I think that is a treatment for Peyronie's disease. Additionally, there are surgical options that you can talk to, your urologist about if some of these fail. But, there is hope for patients. And before, like, a lot of patients felt like they had to live with this. So if you are suffering and your partner is suffering because of a penile deformity known as Peyronie's disease, which is more common than we believe, please seek some help. I mean, you can go to the SMSNA site, the Sexual Medicine Society of North America. You can go to the Xiaflex website, and you can find someone that can help you if you want to try this medication or you want to try the oral stuff. You can find a urologist that might help in the process. And so I just wanted to touch base on issues of male dysfunction that are affecting women, because we just don't hear about it enough. I ask about it in my office because I do very in-depth discussions with my patients on their sexual dysfunction and what's contributing to them, but a lot of people don't get under it, and we should. And so if you're in this category of patients that has a partner that is suffering and is embarrassed, or you're yourself also suffering because you can't figure out how to maneuver it, or it's causing you pain, the plaques are causing you pain, both of you can, really benefit from looking into treatment for Peyronie's disease, whether or not it's oral medication, whether or not it's the injectables, whether or not it is, surgery or penile traction. But I think you need to get into it and get in some help, because it doesn't have to be that way. And, we need to do better in terms of just even for our male partners, just to understand these things are not something to be ashamed about, that we can get treatment for, and you should absolutely get treatment for. So that's my little discussion on Peyronie's disease. As a gynecologist, I know that there's a lot of urologists that discuss it. It may not even be discussed as much as we want it to be, but I'm here to spread the word. Thanks for joining me today for Gyno Girl TV. Please like and subscribe to my channel. Please join me next time. We're gonna have another interesting discussion. Let me know if there's anything you want to hear about, but I'm working on more content as we speak. So until next time, I'm here to educate so you can advocate. Please get the help you need, and we all deserve good sex, right? So let's go.